out. And we're going to be moving forward with our final impression that will allow us to create Procera abutments and all ceramic crowns for numbers 7 and 10. Here's the day of seating. Looks good on 7. We beat up number 10 pretty good. But as time goes on, this young 19-year-old female, still same day of seating. Here's a before and after of the seating day. And here's some time later where we're really happy with what this young individual is going to take with her through life with good maintenance of hard and soft tissues around these 2 implants. And without the orthodontist, we would have been nowhere. So a dramatic before to after. And over 2 years of post-loading success. So I'm going to skip forward. I had hoped to touch on a bit of research that we're getting started on immediate provisionalization in the aesthetic zone. We're going to have to skip through that and just move to some conclusions here. I hope I haven't confused you in this process, but it's certainly, for someone that's getting started with provisionalization, it is a journey that's taken me close to a decade to really feel comfortable with the different techniques that are available to us, and they continue to evolve. But it all starts with good treatment planning with the restorative dentist in a quality laboratory using computer-aided technology, advanced material technology to augment tissues, both hard and soft, and keeping up with the evolution of provisionalization and implant design and an abutment design. A specific attention to the occlusion, that's a key in this, both to the success of the provisional and being durable enough to withstand the occlusal load. What the research was planned to touch on a little bit, but I think Harold will touch on this, is how are we going to be determining whether an implant is stable enough. We just don't, Hamley Wang's recent paper in Jomi, we just don't have a good way of assessing implant stability. The ways we have need to be looked at more. So RFA, the resonance frequency analysis, we're starting to use now to look at this. Indexing should be a routine in your practice. Creating emergence profile abutment and provisional, well contoured and highly polished. And I can't emphasize enough the good lab support. I thank you for your time. I apologize for the rush because we got a late start, but I will entertain any questions as we finish today. Thank you.
The program continues on part 2.